this is Dr. Jeffrey Moss, and I want to thank you for joining me for this edition of Moss Minutes. Today what I'm going to be talking about is actually an extension of what I talked about in the last Moss Minutes, and as you may recall, what I was talking about was the issue of the media and popular perception that if you're healthy, you don't need any supplementation, nutrient supplementation. And using my very bad Jerry Seinfeld impression, I was asking about these healthy people. Who are all these people? Where are all these healthy people? Because research is now showing increasingly that the incidence of chronic illnesses such as diabetes and issues of being overweight or being obese is increasing dramatically. And certainly many of the issues that we're dealing with this whole crisis of healthcare reform deal with the fact that there are increasing numbers of ailing people, of sick people, who need more and more care because they're chronically ill, and of course need care longer periods of time. And so there are a lot of sick people out there who need supplementation. However, one of the things I want to talk about is needing supplementation. Do we need to be a little bit more discerning in terms of the supplementation that we give? I'll touch on that in just a second. But first of all, I wanted to give you information that indeed, when it comes to sick people, they do benefit from supplementation. Now, why is that? Probably for a couple of reasons. Number one, as we know, that their diets tend to be less than optimal, and the diets tend to be deficient in many, all nutrients. I'll discuss that in a second. But also, and as I've really tried to emphasize, the fact is that they're sick, and by the virtue of being sick, metabolism changed so that you need increased amounts of many nutrients. Now, evidence of that, just a couple of studies I want to point out, recently published. This was from the International Journal of Obesity, published in February of this year. Effects of multivitamin and mineral supplementation on adiposity, energy, expenditure, and lipid profiles in obese Chinese women, and they demonstrated that indeed in this obese population supplementation was helpful. Another recently published study, this was in the Journal of Nutrition, Health, and Aging. This was done in a group of elderly patients who did not have Alzheimer's disease. These patients were supplemented with folic acid, B12, vitamin E, S-adenosylmethionine, and acetylcysteine, and acetyl-L-carnitine, and it did help them with memory. Interestingly enough, when they stopped taking the supplements, the improvements subsided. And so what does this demonstrate? That yes, probably these patients are lacking in certain nutrients in their diet, but as I mentioned, by the fact that they're sick, that they are older, metabolism has changed and needs have gone up. However, the old thinking, of course, in supplementing, well, let's just give everything across the board. Not all of it will work, but maybe something will work. And what doesn't work, well, it's natural, so it's benign. So what's the worst thing can happen is nothing. Well, is that indeed true? More and more research is suggesting that no, it may not be as benign as we would like to think because it's quote-unquote natural. A recently published study, American Journal of Clinical Nutrition, this just came out a couple of weeks ago, multivitamin use and breast cancer incidence in a prospective cohort of Swedish women, indeed did find a link between supplement use and breast cancer. Now, fortunately, this study went a little further. It tried to find out, yes, they found a link, but they also tried to find out what were the nutrients involved in this link, and they couldn't find anything definitive. When they had a strong